Why does chordoma often come back after treatment? Imagine a tumor that grows slowly but stubbornly, hiding in hard-to-reach places along the spine or skull base. That's what makes chordoma so tricky. It often recurs after treatment because of its location, biological behavior, and the challenges in removing every last cancer cell. Chordomas usually develop near vital structures like the spinal cord, brainstem, nerves, and major blood vessels. These areas are packed with important tissues, so surgeons can't always remove the tumor completely without risking serious damage. They often have to leave behind tiny bits of tumor cells to protect these critical parts, which can later grow back. These tumors grow slowly, sometimes taking years before causing noticeable symptoms. Because of this, they can go undetected for a long time after treatment. When they do recur, they might be quite large, making early detection difficult. The infiltrative nature of chordomas means they invade surrounding bone and soft tissues, blurring the boundaries between healthy and cancerous tissue. This makes it hard for surgeons to remove all of the tumor in one piece, increasing the chance that microscopic remnants remain. Radiation therapy can help, but chordomas are relatively resistant to conventional radiation. High doses are needed to control the tumor, but these can be limited by the proximity to sensitive structures like the brain and spinal cord. This means radiation might not always eliminate all residual tumor cells, especially in hard-to-reach areas. Studies show that after initial treatment, the chances of the tumor coming back are quite high. Recurrence rates can range from about 30% to over 50%, with some reports reaching 75%. Most recurrences happen within the first 3 years but can occur even later. When the tumor returns, it often worsens the outlook and makes future treatment more difficult. The grade of the tumor and how completely it was removed also influence recurrence. Higher-grade chordomas and those not fully excised tend to come back more often. Conversely, if the tumor is low-grade and completely removed, the chances of recurrence are lower, around 20%. Location matters too. For example, chordomas in the neck spine are more likely to recur because surgeons often cannot remove the entire tumor without causing nerve damage. These site-specific challenges add to the difficulty of preventing tumor return. In summary, the recurrence of chordoma after treatment mainly comes down to the tumor's tricky location, its infiltrative growth pattern, and the limits of current therapies. This highlights the importance of specialized surgical teams, careful long-term follow-up, and ongoing research to find better ways to treat this rare but persistent bone tumor. Always remember, if you or someone you know is facing this, consulting a healthcare professional is essential for personalized care.